Welcome to From the Chair, where better health starts with better conversations. I'm Charlene Shirk, and today we're talking about a dental solution that can completely change your life: full mouth dental implants. Now, if you have ever felt like your teeth or gums are too far gone, our guest today is here to tell you otherwise. Joining us is Dr. Alex McRee, the owner and co-founder of Jax Implants and Dentures. Dr. McRee, we're so glad to have you here today.
Thank you. I'm happy to be here.
Now, I know you have some amazing before and after photos, but before we get to that, let's start with the basics. So when we say full mouth reconstruction, what exactly does that mean? And does it go by other names as well?
Yeah, so there's a few names. There's all kinds of different monikers: all on 4, all on 6, teeth express, teeth in a day. I mean, you'll see a whole bunch of different ones. But basically, they're all pretty much the same thing. It's taking someone without teeth or failing teeth, and then basically putting implants all the way across their arch. And an arch is talking about an upper or a lower, or the full mouth, and then getting them teeth that's on there that are rigidly fixed like your natural teeth were. In simple terms, that's basically what it is.
Okay, now we know what it is. What does it involve, the procedure?
So a dental implant is a titanium screw, no different than a plated collarbone or a hip implant, something of that nature. That's what everyone uses in the medical field, and so that helps teeth actually be attached to them. So much like your roots, your teeth are attached to the roots of your teeth, and you use those to smile and eat with. Same exact thing, basically, except for roots. It is titanium, and that allows you to get back to full function.
All right, well, how does this differ from other options that are out there, like traditional dentures or the snap-on dentures that they have? What makes full mouth implants really stand out?
Well, so dentures, they're both teeth, considered full mouth implants, but that's about where the similarities end. I mean, you're talking about the difference between a car and walking. I mean, it really is that big of a disparity. Dentures, again, you can smile with them, but past that, really, you can't hardly eat anything. And I'm not trying to even over embellish that. It
Right.
really is, the quality of life is just not there. And I think most people who have dentures would tell you so.
There's a lot of maintenance. I see the commercial, you got to take them out. They move around a little bit. Your gums can get a little sore.
Well,
from
when you don't have
those.
teeth as well, you do get bone loss over time. And so your mouth changes, and then, they don't fit anymore, and then they rub, and it's just not ideal. Yeah, simply put.
So by the time patients come to you, I think they're ready for the full process. They are ready for the procedure.
I would say most. We see different, we see people who are without teeth and been without teeth for 20 years.
Wow.
And I see people who are just now starting to head down this road. And it's all different types. We've got people with periodontal disease, cavities, missing teeth, drug abuse, bad dental work, unlucky, a car accident. I mean, it doesn't mean that people didn't take care of those teeth. That's a huge misconception that people think, oh, anyone who needs that just didn't take care of their teeth. And that, I would say that's the far minority of the patients we actually see. Most of it is either genetics or just some other thing that went on. It's not because they didn't brush their teeth. Couldn't be far from it.
Wow. And so what is the real advantage of going with the whole procedure? Like not dealing with the dentures, not dealing with the snap-ons, like really making that commitment. How does it change their life?
Pretty much every way. I mean, I was commenting to some people this morning. It's funny, we take our after photos and we don't tell people to shave or get a tan or get their hair cut, and they show up looking different. And I'm not making it up. They come and they just look like they just care more. I don't know how else to describe it. So confidence, just daily life. Obviously the eating and the smiling and all that stuff, but whether it be confidence for getting a new job or going out on a date or whatever, they just like it. They just enjoy life more.
Oh, and now let's talk about who is this for? Who would really benefit from this type of procedure? It almost sounds like anybody would.
If your teeth are fine and healthy, obviously you don't need it, right? It's not for everybody, but for anyone who's having teeth problems, like what I described before, like any of those problems, it may be a fit for you. We don't know until we come in and see an X-ray and see, what they need, but I can almost do it on anyone. So almost everyone has enough bone. I know we'll probably talk more about that in a little bit, but it's not only does it work, it works very well and very consistently. Our success rate is well above 99%, and that's not some elevated number. That is truly how well it works, and that's for people who think they can't get it done. Smokers, people, diabetes, postmenopausal osteoporosis, and it still works and works well.
Okay, well, let's go into that conversation. So, diabetes, you mentioned some kind of health issues. There are still a candidate. Is there anybody that may not be a candidate for this type of procedure?
There are some rare things that people have had done that might make it more of a challenge. But when I say I don't turn away just about anyone that wants and or needs it, I really mean it. And we see a lot of people here in Jacksonville. I would say we're one of the largest implant clinics here, and we do a really good job. And we just don't really turn anyone away. There's all sorts of different alternative approaches, especially for the top jaw. There's remote anchorage is what they call it, but basically there's different styles of implants that are going to get you the teeth that you want. And it won't look any different, won't feel any different. There's all sorts of big words like pterygoids and zygomatics, which people are like, I don't know what that means. But regardless, it's the same car. It's a different engine under the hood, but regardless, I can get you that car. I mean, I know I keep referencing a car, but it makes logical sense because it's something you use every day, and it's something very valuable that people like. And so that's why I make that comparison, and we can do that.
I can see the passion in wanting to help people, everybody who walks through that door. So let's start talking. Okay, so I've walked through your door, right? Talk to me a little bit about what is the process? What does it look like for a patient?
Really, it starts with if you're watching this today or something. And that's where it really starts is making that call or going to the website or just educating yourself on what this is. Because not everyone knows that this is a thing. I don't expect people to know this is a thing. This is kind of a niche thing within dentistry.
Well, that's why we're having this conversation.
Yes, and because even my parents, I went to dental school and they're like, I don't even know what you do, but because they didn't need this procedure. So it's educating yourself on what's possible. Because I say, oh, we can get take out teeth and put implants in and get you teeth that same day. And I've had relatives say, okay, but you just say that. That's not. You can't really do that, right? That's some sort of marketing thing. I was like, no, I do it, and I do it every single day. And so it just sounds, I don't know if that's a right way of putting it, but too good to be true. But it's not. It works, and it just works so well.
Well, and technology is always changing as well. So they may know what you did last year, but this year you may be doing something different because you are on the cutting edge of technology and how this is evolving.
Yes. So I mean, and we'll go over that more. Going back to your last question, the consult, we come in and we explain all their options. And going back to your technology, everything we do is in-house, and we don't just say that. We have a large, lab team. Everything is done start to finish. We don't outsource anything. Everyone's on site. Everything's American made here in Jacksonville. We mill it, we design it, ceramics, the surgery's done here, restorative's done here. You don't ever have to go anywhere else, and nor do we wait on anything else for anyone. We don't have any shipping. There's no lost in translation. Oh, well, the lab, I'm sure you've heard say, oh, the lab messed it up, or UPS lost it. I was like, that just does not happen here. And there's no miscommunication because it's right in our own operatory.
And that is really what sets Jax Implants apart as well, because you are a one-stop shop.
Yes, and it's all we do.
Not everybody is.
Correct. And I think that we focus solely on dental implants, which allows us to be good at what we do. I don't do veneers. I don't do fillings, and there's no problem. That's great there's people in Jacksonville that do a fantastic job of that. That's just not what we do. We're focused on what we do, and we do it well. And you see, we're trying not to be a jack of all trades. Everyone is trained in it, and it's not just me. I think I'm pretty good at it, but it's the team, right? So whoever answers your call, they know what we're talking about. The assistant, they know what we're talking about. The surgical team, they know what we're talking about. And it's not because they're not trying to do too many things, so everyone's on the same page. So it makes me a better dentist because I have a better team around me.
That's awesome. Yeah. Well, you mentioned too, as you said, like it's almost too good to be true kind of thing. People can actually come in that same day, leave with a new set of teeth. Okay, so let's walk how that actually works.
And so that is just a mind-boggling thing for most people. And it's something we do, again, and I'm not embellishing, I keep saying this stuff, but I get this question, I get weird looks, right? I get suspicious looks every single day. And so we have teeth on there every single day. They come in, if we're removing teeth or if we're not removing teeth, whatever the patient has, place implants and have teeth that are originally fixed on there that day. So they can go out and smile and eat on soft foods that day. Now, we don't recommend hard foods during the healing part, and we can talk more about the healing and stuff like that in a little bit, but they can go and smile and they look fantastic. Oh. And actually on our website, I actually do we have a bunch of before and afters that I think look fantastic. And a couple of them I left on there that are temporaries, just because I get that question. They go, okay, but that's a temporary, I'm not gonna look good. And I'm like, okay, well, you tell me You tell me which ones are temporaries, and I'll give you a gift card. But they look fantastic. Because everyone's heard of having a temporary crown or something. It didn't look good, it didn't fit good. No, these are, I know they're considered temporaries, but they are top notch. They look fantastic. And it's just a healing phase set of teeth, but the craftsmanship behind them is over the top.
All right, so to come in for this procedure, as much as I can leave today with a brand new set of teeth and a beautiful smile and my confidence is gonna go out of the roof, some people are anxious just to go to their own dentist and get a cleaning. And this is a pretty big jump. So how do you make people feel comfortable with that? Because I would hate for that to be the thing that keeps them from really improving their life.
Yeah. And this, I would say this is our largest subset of people, is one, no one wants to get surgery with anything, right? And so coming in is a huge fear. And we have a lot of patients who haven't seen a dentist in 10, 20 years. Because of a bad experience.
Right.
Because as a kid, they were, God, I hear the stories that they got the dental work done that day, but they'd never go back. So a lot of patients we see some have been getting regular dental stuff work and got unlucky. But a lot of people say, I only go to the dentist when it hurts. Or I'm not going to the dentist until I'm forced to. And now I've gotten to the point where, I raise my kids, or it's just gotten to the point where that final tooth broken and you go, I got to do something.
Right.
But anxiety is what's kept them away. And so yes, we do everything in our power to make it a comfortable setting. I'm a pretty, low-key guy. Our staff is just normal. I don't know how to say it. And, we're gonna treat you like a person and make sure you're comfortable, and we're not, people are they cover their mouths when I, come into the consult.
It must break your heart when you see folks
I was
like
but
that.
that's what you came to me for. We're not gonna worry about that. I see it as a positive. I was like, I see what you got, I understand, but you've got a house that needs to be rebuilt. All I can think about is how the house is going to look. And I was like, and I know you don't know that yet. You can't see it, but I see what it's going to be, and you're going to absolutely love it. And so that, we'll get past that. I mean, we have, almost everyone's anxious. It's kind of odd if you're not anxious. And obviously we'll do, we'll talk more about like sedation and stuff like that actually, helps medically with the.
Well, let's talk about that because a big part of the anxiety is the fear of being in pain and pain that it's going to hurt during this procedure. So let's address that. Let's address the fear in the room.
Yes. So the first thing I was talking about was the environment, and how we actually, make someone feel welcome and feel like they're a part of the family and feel like they're going to be treated well. Well, the second part is, okay, well, there is a certain level of anxiety that you just can't get rid of with no matter how much, soothing sounds you play. And that's where, okay, so, we do a lot of different styles of sedation. We can do laughing gas for someone who's just maybe getting, a single tooth pulled or something like that. But for the big stuff, most people want more sedation. And I understand that. So we have multiple different ones. We do oral sedation, which works really, really well for actually pretty high percentage of our patients. But we also offer IV level sedation with an actual anesthesiologist that comes in. And so you'll be fully asleep the entire time, and we can do it any which way they want. Both are highly effective, but no, there's no one that's too anxiety. You can't have too much anxiety. We can help it.
And how long is the actual procedure?
So the actual procedure, so if I'm only doing a single arch of teeth, say which is an upper or a lower, an hour. I mean, that's with taking, even if I've got to take out a full set of teeth that maybe are damaged, and I'm not rushing. It's just because, it's just efficient. It's done well. It's done repeatedly. And then it does. So, what that does is consistent results. And that's what you see in our results is it's the same thing every single time. Obviously fit to each patient, but exceptional results every single time. And that's the standard we have, and it's no exceptions.
Now, for someone who's going to go under IV sedation, I'm going to assume that they're pretty afraid of the procedure or the pain, and they want to be knocked out. Are they going to remember anything about the procedure after that?
No. And so there's a pretty nice little cocktail of drugs that the anesthesiologists can use. So no, you're not going to remember the procedure. And at that point, once you've got the surgery done and your teeth are on there, obviously we have follow-up visits. But at that point, you're never having to be numbed again. You're past that. So the hardest part is obviously for most with anxiety is the initial procedure. And so if we have anxiety at that point in time and use our IV sedation or our oral sedation, we're going to get past that with flying colors, and then it's smooth sailing from there.
And oral sedation just means you don't feel anything that's going on in your mouth. What does that mean?
So local anesthetic would be more for actually numbing, right? So even you still do that even when someone is being fully sedated. But oral sedation is like a pill. We use a different, it's called Halcyon. Works similar to like a Xanax or a Valium. Okay. It's a little bit better than that.
And it just keeps you calm.
Oh yeah.
Takes away all that.
I've seen
Takes
the
off
most
edge.
anxiety-ridden people absolutely just be a dream. But again, you don't have to. If you're like, look, that sounds great and everything, but I'm doing IV. Fine. Yeah, that's what we do it more a la carte. So we don't have to do it one way. Whatever you want, we can do.
Okay, now let's talk about recovery. So we've gone through the procedure. Yes. It's gone fabulously, yes. Right? And now I've got my great, fabulous smile, but there is some healing to be done, right? So how quickly can we get back to eating, smiling, and getting back to normal life?
Yeah, so I would say most people can go back to work in a few days, depending on what you do for work, right? If you're a power lifter, maybe like a little bit longer than that. But even at like a week, you're pretty much back to 100%. You can go and exercise. You can go run. You can obviously eat on a softer diet. You can smile. Your speech is fine. I mean, I know we wait usually about 3 months or so for everything to kind of settle. But again, I referenced the hip implant before. But so if you know anyone with a hip implant, you'll know that they're walking next day. And so you think crazy, like how is that possible? So the same exact thing for us, it's very similar. Doesn't mean they're in pain while the entire thing's healing. So very similar, we have you eating soft, right? That's walking. I'm walking your teeth here. And so that way, once it's healed, just like with hip implant, and any other implants you have, knees, whatever, you're back to full speed once it's fully healed. But it doesn't mean you're in pain the entire time you're healing. That's very, very minimal. It's just letting everything osseointegrate, which just means that the implant is fused with the bone, so that way you can chew effortlessly and do whatever you want.
Okay, so the healing you mentioned takes a couple months, and before you get your permanent, because you said,
yes.
But your temporaries are going to look fabulous,
yes.
right? And so why is that important that it's like you just mentioned the healing, but for a couple months, that just seems like a lot of time.
That's a great question, and I'm glad you asked that because I do see a lot of marketing or some people talking about going straight to finals. And we can actually do that, and we've done it. We've actually done same-day finals. People came in, teeth out, implants in, and actually put in the final zirconia teeth same day. That's a very rare instance that we feel like that's indicated, and I would do it on anyone that asks, but I feel compelled to let the patient know, hey, that's not what I would recommend. And there's reasons for that. Basically, when you do all the surgery, right, everything's nice and level, but suffice to say, you're gonna have a little bit of swelling, right? And that's normal, that's what everyone does. And so everything's gonna settle, even if but a millimeter. Right, but anyone who has a bridge before or anything, you don't want stuff getting stuck between your teeth, right? But if you had that settled just even a millimeter, now there's a gap formed. And so if you were to go straight to a final, that gap's gonna form. I don't care what you do, and it could be minimal. And then you're gonna get basically food stuck in your mouth for the rest of your life. So we wait for everything to settle, so then everything's made nice and flush, which is, just letting, it's kind of like pouring a foundation for a house the very first day and then framing it out immediately. It's like, whoa. Let it settle, and then make your final, and then you're good for years.
So as your gums heal, they're kind of changing their shape a little bit, is what you're saying?
Yeah, I mean, it's not drastic. It's not like you're not talking large changes.
But I would think there's a little bit of swelling too, right? So you've got to let that go down.
A millimeter can feel like a mile.
Right.
And this is a big investment. And so we're going to do it right, and that's what I would do for myself. It's what I would do for my family, and so that's what I'm going to do for my patients.
And you mentioned some patients come in, and they cover their mouth even to you. They've got to be really struggling, being very self-conscious about their teeth. And you mentioned, hey, it's great. You've got a lot of functionality. That's wonderful. You can chew and eat whatever you want. But you said they almost like they're a different person when they come back to you. Like they look different. Talk about maybe the emotional and psychological impact of having this procedure.
It's life-changing. And I know it's dentistry, right? But it by definition is life-changing. If someone gets a filling or a crown, most of the time, you don't even want to do that, right? I mean, it's like, man, the dentist told me I had a cavity. I don't want to do this.
And half the time it's in the back of your back of your mouth. Nobody sees it.
Yes, and so that feels like a hassle. And I'm not saying anyone wants to get this done, but the impact is life changing, and you see it in their gait, in their smile, in the way they say they go out and interact with people. I mean, I hear about people that won't leave the house because of it, or they're afraid to go on a date maybe, or they just feel down on themselves. They raised their kids and they weren't really doing stuff for them, and then they're like, I finally want to do something for me. Or wives might book a consult for their husband because they won't do it, and they're like, I'm tired of looking at it. And so we get that quite a bit too. And then it's funny because I'll have a lot of guys too and say, I just want to eat. I don't care how it looks. Well, 3 months later, they're very happy with how it looks, and because, and it's not too vain to, like guys like to look good too.
Well, I also think for employment, right? That
Yes.
would be very self-conscious, and maybe you're not in the career that you want to be because you feel like that's going to hold you back.
Yep, 100%. I hear that day in and day out that say, it's not that I didn't have a job. It's not that I couldn't get a job. I didn't even realize how much I was kind of just hanging back
Holding
a
themselves
little
back.
bit, and then now they just feel more free. And it's just it's nice to see. It's impactful to me. I know my team likes it, because you see people actually shedding tears of joy about their life, and it's like, well, that's cool that I was able to be a part of that. Obviously, and it was the whole team, and it's not just me, but it is fun to be a part of that.
All right, let's finally get to those before and after pictures that you were telling me about so we can see the difference that it's making. So you mentioned that a lot of the men come in and they just want to be able to eat. They don't care how it looks, right? But now you've got an example of Mike who, wow, talk about a glow up for Mike.
Yep. So Mike came in, so still had some teeth on the top, missing a few. You can't really see them. You can see this whole side over here was missing. His issue was periodontal disease. So it's a slow process, but they were starting to get loose, right? And so those teeth, were deemed hopeless. So we, again, upper and lower full mouth implants for him. You're going to see the difference.
Hello,
here.
Mike.
So Mike's looking great.
Hello, Mike.
He's coming in wearing a suit.
Wow, yes, he's wearing a suit in this. His hair's all gelled back.
Yeah, and so we don't tell him this is just the day of his finals. This is just how he came in. This is not a photo shoot.
Wow.
This is just him now. And yeah, Mike's looking pretty good.
And eating whatever he wants.
And eating whatever he wants, and not worrying about his teeth being loose or one falling out, and so that's just not a concern for him anymore. Just his overall appearance just looks better, healthier, and more confident.
I was just going to say, you could feel that confidence coming through that photo.
Yeah, it's just oozing off the paper there.
Where was he going after his new teeth? He was going
I don't
out
know,
somewhere.
but somewhere to look good.
Mike's going out. He's going to take a lady friend out somewhere. It looks like he's ready to go.
Yeah, no, it makes me jealous. Those look good.
Now, you mentioned earlier we were talking about the difference between the dentures and the snap-ins and then this full mouth dental procedure. And so you have people coming in who have been dealing with dentures and all that entails, and they're over it.
Yes, and so this one right here, Venicia. And so her teeth up here, and I'll talk about why we improved her aesthetics, but this is an upper denture.
Okay.
It's actually a snap-in denture. And so she came to us because they just don't work well. I mean, they really don't. So she had spent some effort, and some time and had a surgery done before, and still was unhappy with not just her smile, but the aesthetics. It doesn't fit. I can't live my life how I want to. I want something better.
They have limitations. Dentures have limitations.
Correct. And they can look good. This particular one, whoever made this one, really didn't do right by her. But you'll see here the difference. I mean,
her whole smile line, like her lips look different.
Yeah, so I'll put them side to side a little bit here. And so it's called a reverse smile line is what they have on this particular set of teeth. Right here, you want to follow the bottom lip line. That's hugely important. You don't notice as a layperson, but that smile just does not look, it does not fit her. Right? That was made from a mold or something, or someone was not paying attention. And also her incisal edge, which basically just means how much tooth do you show? Right? And so if you look right here, following the bottom lip line and not showing enough tooth, and I go right here.
Oh, she's full on smile.
Beautifully, showing the appropriate amount of tooth. That's how it looked. That's how it should look. That fits her. So, people think, oh, well, teeth if they look white, they look good. That's one part. That's one of many, many facets. It's the shape. It's where they're set. It's the embrasure work. It's the depth of it. It's not even just the white. It's the chroma and hue, because most teeth are a little bit translucent. So you see some people with crown work, and you ever see that it just looks, it's white, but it looks like a sink. It's
yes.
It's not very
chalk, like they've got pieces of chalk in their mouth.
Correct.
That kind of white. Yes.
And so the material that we use and the way that we do it looks natural. And it's the way it reflects light. It's slightly translucent, which mimics natural teeth, which is why when you see these photos like this, that looks how it should. Even a layperson, I think, could see and say, I don't know what it is. I don't know what they did differently, but that looks how it should.
And she's a beautiful woman, but she looks like you shaved off 10 years just from her smile.
You would never perceive that those are not her natural teeth. I mean, there are her natural teeth because obviously they're hers and she uses them, but you would never know that's what she wasn't born with. And that's a huge passion of ours, and that's a huge fear of a lot of our patients. Is says, I've seen people with bad dental work. I've seen people with crowns, dentures, whatever,
Right.
and it doesn't look good, and I don't want that. And
Well,
I don't
that's
want
what happened to her. She got that denture and it didn't really do anything to flatter her because she's a beautiful woman.
Exactly. And so I want to alleviate that, and that's why we put a lot of our before and afters online, because I want to show you we can do it again and again and again. And then you also may find someone that looks like you or has teeth like you. And so that way you can go and say, look, I want mine to look like that. Because we have a lot of patients that actually would come in and reference, and we even have people that come in, bring celebrity smiles and stuff too. But yes, it just shows that we can make it fit the person and make it look really, really nice.
So earlier we were talking about some of the causes for people who end up needing this type of procedure. And you said some of them it's just genetics and some of them it's just kind of bad luck. And here we have somebody who's apparently just didn't get the right gene pool when it came to her teeth.
Correct, yeah. So we have Holly here.
She's so young.
Correct. I would say our average patient is probably in the 40s or 50s. We've went up into the 90s, even 100-year-old, and it works really, really well. We've also been in the 20s. She didn't not keep care of her teeth. She had a whole family history of it.
Oh, wow.
Mom and dad had dentures, grandparents had dentures, and she said, I'm not going to do that. I'm going a different way.
Bless her heart.
And so she was kind of set up from birth that this was going to happen for her, but that's okay. Modern medicine, we can fix that.
She showed up at your door?
Yeah, and so
well,
now,
hello, Haley.
it's an investment in herself, right? In her career and what she wants to do as a person. And so now she doesn't have to worry about, all the cavities that she was having. That's what had caused her issues, was her teeth were breaking off because she just had rampant decay, and it didn't matter what she did, it just wasn't going to get better. Right. So she decided, I'm not going to dentures. I'm not going to do that. I want to smile. I want to live my life. I'm young. We want to set her up for success, and those are going to last her a long, long time. And so she can now, just live freely and just live without dental concerns.
And doesn't have to worry about those continuous medical issues. That
Yes.
She can enjoy her teeth and live a healthy lifestyle.
Yep. And so this is evident. It's really, there's no race, rhyme, reason, age. It doesn't matter. Everyone can have dental problems, and we can fix it on anyone who needs it.
So for someone who's just watching this and they're still a little nervous, right? Whether it's the fear of the pain or maybe it's the cost or it's just like taking that first step to have that first conversation, what would you say to them?
Take the first step. And we try to do it any which way you want. If you want to schedule yourself, if you want to call, if you want to send us an email, it doesn't matter. So some people like to call, right? Some people want to fill out their information, have us call them. We want to make it as amenable for you and make it as easy for you and lower the anxiety and reduce the barrier that you've had to get in contact with us. So it doesn't matter which way you want to do it. You can call us at 904-999-9000. You can go to our website at jaximplant.com. I said on there you can schedule yourself. You can have you can chat with us. Whichever way you want to do it, we can do it. But you got to take that first step, and then we can help you.
And there's no pressure to make the decision that day. You can go home, you can think about it, talk to your family about it,
Yep.
Take that, because some people they need to take that time to process
Well,
something
and that's
like this.
a huge thing that we do is we do complimentary consultations. It will not cost you anything. You'll have a full set of x-rays, you'll have a full workup, the entire thing, and you do what's right for you. We are not high pressure people. I will tell you what we can do. You do what you want to do, and you will hear the same exact thing when you come in. I'm not telling you what to do. It does not matter to me. I want you to be happy. I want you to get what you want and make the decision for you, and not for you, but for your family as well. And so you're happy, and then you don't have pressure to do anything that you don't want to do.
Well, Dr. McRee, thank you so much for joining us today. This has just been so inspirational. I really appreciate you taking the time and sharing the stories of your patients.
Thank you for having me.
Well, I'm Charlene Shirk. You've been watching From the Chair, and until next time, keep smiling.